So, welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal, and today I would like to give some reflections on how I feel that is controversial to establish hypnosis in clinical practice, or it's controversial or it's difficult for psychotherapists to think on integrating hypnosis on psychotherapy. And I would like to give some reflections on how it can be difficult, and how I can understand that a lot of therapists from different therapeutic backgrounds can see hypnosis and see how difficult it can be to integrate it and to utilize in clinical practice. So one of the first reasons that I can think about is the difficulty in establish a unified definition of hypnosis. If you research the history of hypnosis, you will find that hypnosis has a lot of theories. Most of the theories are divided into two parts: the state definitions of hypnosis and the non-state definition of hypnosis. So the state definition of hypnosis is hypnosis associated for a state of altered consciousness, of trance, of some dissociation and profound unconsciousness alterations, and really alternate state of consciousness. The non-state theory of hypnosis is established that hypnosis is not an altered state of consciousness. Hypnosis is a product of an interaction between social and cognitive variables like the response expectancy or expectancies response set, role-playing, role enactment, the suggestions from the therapist, in a sense that, well, non-state therapists or social cognitive therapists or cognitive behavioral therapists consider that hypnosis is only based on suggestion, and only based on direct suggestion, is a byproduct of suggestion. So in not having a unified definition of hypnosis, I can imagine that it's really difficult for someone to pick up hypnosis and to say, well, that's hypnosis, that's the definition of hypnosis. And really, it's generated some controversy because Division 30 of APA, Society of Psychological Hypnosis, establishes or tries to establish a unified definition when the members or the chairman really change. So if you research along the years, you will find that Division 30 of APA produced a lot of definitions or attempts of unifying a unique definition of hypnosis, and some of them are subject to intense criticism. In that sense, I think that it's difficult for someone to pick up hypnosis if it isn't easy to define what is truly hypnosis. Another thing that it's difficult for clinicians to pick up hypnosis is the product of the history of hypnosis and the myths that exists with hypnosis. I think that the main difficulty is to pick up something that is also utilized in entertainment. If you see therapeutic approaches like, for example, cognitive therapy, like psychoanalysis, or specific techniques like relaxation, progressive muscle relaxation, biofeedback, EMDR, if you consider to be a technique or a type of psychotherapeutic model. Those kind of approaches, those kind of techniques are strictly utilized in clinical practice. Hypnosis, however, is utilized in entertainment and also in shows and really bad demonstrations. This happened because at some point hypnosis was dropped by the medical and psychiatric community, and when they decided to drop hypnosis was picked by entertainment showmen and showwomen, and really there were a lot of shows and fairs which established hypnosis as a kind of tool for entertainment. And after World War One, or maybe in WW1 and 2, when PTSD or shell shock problems were appearing, and the means to intervene were very few, hypnosis was considered to be a good intervention for PTSD and shell shock symptoms. However, when physicians were trained in hypnosis, they were trained by artists, by entertainers. So the style of hypnosis and the way that they do hypnosis, that they did hypnosis, is a way which was very showmanship and really not adequate to clinical practice. So if you consider that, it could be one of the reasons why why therapists don't pick up hypnosis, because they associate it with entertainment, with shows, and also with past life regression models and the past life regression theme. I'm sure that everyone knows that in a certain point of time, hypnosis was utilized by some people to facilitate what they call past life regressions. Hypnosis is not for past life approach, a regression approach. You may find regression therapy and other forms of doing regressions without hypnosis, but hypnosis really was popularized by people associated with the phenomena of past life regressions and past life reincarnations and all those kind of things, which scientific studies debunked the idea if you are interested in know, past life regressions with hypnosis are they are equal to false memory syndrome. So they are not. We can't evaluate. We can say if past lives exists or not. So it's not a scientific approach to utilize past life regression. But as popular as it is, hypnosis is utilized or badly utilized in past life regression therapy styles, and I believe that is one reason why psychotherapists don't want to integrate hypnosis in clinical practice. Another idea that I have for not integrating hypnosis is the idea of hypnotherapy. So let me just say that hypnotherapy is a term that is mildly incorrect. Hypnosis is not a therapeutic model. For hypnosis to be a therapeutic model, hypnosis have to explain how the brain works, how the personality develops, how disorders appear in everyone. And no theory on hypnosis can explain that. The theories of hypnosis, they only explain how and why hypnosis works, not psychopathology. So hypnosis is not a therapeutic model. Hypnosis is a coadjuvant, something that you can integrate in psychotherapy, and that's why you have various models in psychotherapy that can integrate hypnosis. The first one, and the historical one, is psychoanalysis. If you think about it, Freud and Breuer, the fathers of psychoanalysis, utilized hypnosis prior to Freud's conceptualization of psychoanalysis, and even in the first years or the first attempt of psychoanalysis, Freud utilized hypnosis also as Breuer, and Jung also utilized hypnosis. There are a lot of psychoanalytical figures that utilize hypnosis. In that sense, hypnosis with psychoanalysis is called something like hypnoanalysis. CBT models also integrated hypnosis along the years. Some researchers claimed that hypnosis and the practices of hypnosis predict cognitive therapy and also behavioral therapy approaches. Specifically, the way that Antoine Libidinot and Hippolyte Bernheim utilized hypnosis. They utilized it in a social cognitive way, in a manner that Bernheim defined as suggestive therapeutics. Bernheim really established what psychotherapy is beyond psychoanalysis, in the sense that it is a suggestive relationship, a mutual intervention between therapist and patient that can expand or focus some of the areas in which the therapist can work with the patient. Bernheim really evolved the concepts of hypnosis beyond what it's the mind-body interventions. He established hypnosis as a tool to be utilized in psychotherapy. Along the years, a lot of researchers integrated hypnosis into CBT interventions. For example, you have Hassan Aladdin with cognitive hypnotherapy. You have the works of Thomas Down with his colleagues. I forget the name. Their names Friedberg. Well, Golden and Friedberg, I think. But certainly doubt integrated hypnosis with CBT. You have, for example, Donald Robertson and the models of Stephen J. Lynn and Irvin Kirsch. You have, for example, the new approaches from the Valencia active alert model of hypnosis, which is a variation of waking hypnosis. You have a lot of people, and they continue to integrate hypnosis into psychotherapy. One other reason why clinicians don't integrate hypnosis as much as they can is by lack of credible information. For example, a lot of well-established clinicians at some point utilized hypnosis or validated hypnosis as a possibility to join with specific therapeutic interventions. Some names like Joseph Wolpe, Arnold Lazarus, Albert Ellis was influenced by the autosuggestion paradigm of Emile Coué. Aaron Beck at some point credited hypnosis as a means of intervention in cognitive therapy, and very similar to guided imagery and visualization techniques. John Watkins with his ego state therapy. Some EMDR approaches can be integrated and can integrate hypnosis. A lot of Ericksonian people, I suppose, and a lot of well-established clinicians at some point validated or utilized hypnosis. So people don't know that, or don't really know the deep of their opinion about hypnosis, and that's why why clinicians don't use hypnosis as much. Finally, I would say that the debate between Ericksonian approaches to psychotherapy and hypnosis and social cognitive views of hypnosis is a main dispute that can really push back therapists in utilizing hypnosis. We have to give some credit to the Ericksonian approach, mainly Milton Erickson, because Milton Erickson popularized hypnosis in clinical practice. A lot of people that started to get into hypnosis and to utilize hypnosis in psychotherapy, they started by learning the Ericksonian approach, the Ericksonian style of doing hypnosis. At the same time, in the research stand, social cognitive and cognitive behavioral therapists really pushed hypnosis as a well validated and well researched based intervention, and that started a war because Ericksonians believed that their approach is more efficient, more established, more efficaciously developed beyond social cognitive approaches. Social cognitive therapists say that Ericksonian approach to hypnosis is a poorly researched based evidence style and view of doing therapy. As someone who has training in both approaches, I can see the difficulties and I can see the criticisms in each parts. It's well established that Ericksonian approach is something that it's very difficult to research in an evidence-based way. If you think about it, Ericksonian approach, especially to hypnosis, relies on tailoring the approach to a specific patient, utilizing indirect means of suggestion, stories, metaphors, analogies, utilizing paradoxical interventions, which they can't be well researched. You can't standardize a specific intervention into doing the same repeatedly to different people. That would be against the Ericksonian principle of doing hypnosis and psychotherapy. And at the same time, social cognitive therapists established that there aren't really statistical significance, statistical differences in the efficacy of direct suggestions versus indirect suggestions. Both of them are equally strong, and no other is stronger than the other. So they can be it's not a case of some approach is superior to another. And certainly you can criticize a lot of Erickson's views about psychotherapy and hypnosis. Lastly, I will say that Ericksonian approaches to hypnosis and psychotherapy are very diverse, because Erickson didn't standardize or manualize his approach, his ideas to psychotherapy and hypnosis. That created branch of different approaches from his students. You have a specific view by Ernest Rossi, another view by Jeffrey Zeig, another view by Stephen Gilligan, another view by William O'Halloran, and all of them are different. They can share specific principles of the Ericksonian approach, of Erickson's ideas, but they are different between them. So it's not like you have a cognitive hypnotherapy that it's a standardized, a manualized approach, which you have specific phases and specific psychotherapeutic movements. So in that sense, I can acknowledge and I can understand why it's so difficult for therapists to integrate or to decide to integrate hypnosis in clinical practice. These are some thoughts. I know that there are more reasons why you shouldn't, why people don't integrate hypnosis in psychotherapy. I would like to say that hypnosis can benefit more psychotherapy than damage the process. Please excuse me, I had a little brain freeze. So there are more advantages in utilizing hypnosis if the situation and the patient demands it, that you don't utilize hypnosis. You can have more advantages in focusing someone's attention and talking with them in the more suggestive way. You can have more results in that manner without you feeling that you are at some point manipulating the person. It's not manipulation, it's not dark psychology, it's not the dark side or something, really. Everyday people can't be, and they are suggestive to some things. We all respond to certain suggestions, to certain ideas, to certain ways of thinking. So we are constantly in a suggestive state. It's not the dark side, believe me. I would like to thank you for your time, and please excuse some of my mistakes and brain freezes. I'm spitballing, so please be safe, and I'll see you next time.